I'm the President and CEO of the Danville Regional Foundation. I also have the honor of being the chair of the advisory board for the Virginia Funders Network. And on behalf of the advisory board, I am pleased to welcome you to PFN's third annual conference. This conference brings philanthropy leaders together from across Virginia. Attendance has grown each year from the first conference when 175 gathered in Williamsburg to this year, where registrations topped 300. In fact, we're at maximum attendance. What a remarkable thing. Over the next 2 days, you will meet, connect, and learn from conference participants and speakers assembled here in Richmond. And I feel assured that you're going to discover an idea or two to explore ways to work together to advance opportunities for all who call Virginia home. The conference theme of Stronger Together, Collective Action, Collective Impact is woven throughout the more than 24 sessions offered over the course of today and tomorrow. So please take a moment to download the conference app. And throughout the conference, PFN staff will be around to answer any questions anybody has. Our opening plenary today, How Anchor Institutions and Philanthropy Drive Systems Change for Community Well-Being, I believe will set the stage for the rest of the conference. Our lead sponsor for this session is Sentara. And I invite Anna James, Senior Vice President, Government and Community Relations at Sentara, to say a few words and introduce our keynote speaker.
Thanks, Mark. And it's great to see such a big crowd here, but what I've noticed is that everyone's in the back, right? And I feel like that's our daily job as funders. We're always the ones in the back pushing forward the great work of our funding partners, aren't we? So this is very representative of kind of our day-to-day, isn't this? But if anybody wants to come forward and hear John's great speech, feel free to. So my name is Annie Henley-James. I'm just proud to be a sponsor here from Sentara. And as you know, Sentara has been on a journey as it relates to our community giving and our and really empowering our communities. And a lot of that work couldn't have happened except for our next speaker, John Martin, who's been driving us, pushing us, and really coming up with what that strategy looks like. But as you know, everyone in this room can't do it alone. And so really focusing on that collective impact model, how can we all come together to further the needs of the community, empower them, and uplift them? And so at the end of the day, that's what we're all trying to accomplish. And so it's great to see so many people here today. So our next speaker is John Martin. He's CEO of SIR. He's a futurist, which is the best title I think ever. He's an author, and he's just a well-known person throughout Virginia. He has been a shining light in all the Sentara work, and you can see his fingerprints and him always pushing us to do more and to give more back. And so without further ado, his bio is in the back that I present John Martin.
Well, thank you, Anna. And good morning, everyone. I tell you, that's a great metaphor. You're sitting in the back, but I want to share with you why we all need to sit in the front row. And that gets to really what my themes are today. There's a growing need mounting across Virginia, and really it's something that we've all got to get ready for and be prepared for, and I'm going to get into the details of that. But a new perspective can really help us build trust and scale our support. And that really lies right in your hands, which is the third thing I want to talk about, immediate next steps. I'm going to do all this in 30 minutes. Did I come to the right place? Okay. All right, well, there's a growing number of Virginians that need our help. And this is like bringing new kind of coals to Newcastle for you guys, because you're all aware of the data, and you look out there, but boy, there is a growing number of people living in poverty. And when you look at the poverty rate, I hear people that don't know numbers very well go, look, it's 11%, it just sticks there, we're doing a great job. Not really. Not when you look at behind the numbers, you start to say, oh my gosh, but we're increasing as a population, the U.S., and so that means 11%. We get more and more people in poverty. Just 6 more years, we're going to have 3 million more people. And in Virginia, we're going to have 57,000 more people in poverty. That's Charlottesville. Like we're going to add another Charlottesville of people in poverty in the next 6 years. So that's just kind of unacceptable. But it's a bigger story than that. We are living on the edge. We are literally living on the edge. So many of us in our society, in Virginia and across the country, and really around the world, 63% of us live paycheck to paycheck. 32% can't cover a $400 emergency. I mean, that's a flat tire, right? Oh my gosh, it is just so expensive out there. And I think the United Way has done a great job putting a face on this. It's called ALICE. You guys are familiar with that term, right? So really kind of a cool asset, limited income constrained employee. It's a better way of saying the working poor. And these are hardworking people, many that have 2 jobs. And if you look at the ALICE population in Virginia, including poverty people, it's 39%. So 2 in 5 people are just barely making it. And I tell you, when you start looking at some of these numbers, and they're kind of scary. Auto loan debt at all-time high. U.S. credit card debt, all-time high. Student loan debt, all-time high. Rent outpacing wages. And then food prices. Oh, it's not a good story. And I know you didn't come here this morning to get bummed out, but I have to tell you, this is a wave of mounting pressure of people that need more and more help. Increasing number of older people on a fixed income. So, boy, I'm getting close to retirement, and I go, yeah, Social Security. Yeah, it's not really retirement income. When you really do the math, you see that the average recipient gets $21,000 a year. Well, the ALICE survival budget's $30,000 for one individual. So there's a gap there, and not many people are really saved for this. And if you look at the ALICE population by demographic age, they're over 65 plus. Half of them are in the ALICE population. This is not a good story. It gets worse, because when we look at the numbers behind aging boomers and seniors, if you look out, as far as the census goes to 2060, it doesn't stop with the last boomer. We're going to have more and more older people. You know, we're living longer, and that birth rate is falling off. We're going from a population triangle to a rectangle. Whole other problem with not having a number of young people for working. But when you start looking at what's going to happen in Virginia, we're going to go to 20% senior. What state is 20% senior today? Florida. Right. They're going to 30% senior. Oh my gosh. Increasing health matters directly related to this. When you start looking at this, my mother used to always come back from her wonderful lunches with all of her friends, and she called them organ recitals. Well, what do you mean? She goes, we just talked about our failed organs. So I think that's a good kind of idea to understand, because in healthcare there's something called comorbidity. And the older you get, the more chronic diseases you get. They conspire. They're not your friend. Once you get 2, the third one comes real fast. And so that happens with age. And you've got doubling of seniors, you're going to have a doubling of chronic conditions. And millennials, I like to have fun with millennials still. Millennials, you think that they're like the epitome of health. They're young and spry. Well, how many people know this? When you look at COVID and the impact it has on psychological distress, before COVID, 3.9% of adults. After COVID, almost 14% have some symptoms of serious psychological distress. 14%. Wow! Now let's look at this generation, millennials. 25% have some serious psychological distress. That's 1 in 4. Yikes! And then here's the scary thing. If you look at the top 11 chronic conditions, millennials outpace the rest of the population in terms of prevalence or incidence of having those. Who would have thought? Get me back here to talk about why on this particular one. It's just kind of crazy. But on top of all of this, we have declining trust. And this is so scary. If you just look at every one of our institutions, falling trust in people, falling trust in companies, falling trust in government. Yikes! We're here to help you. And AI does not help and build trust. Look at this guy. I don't think he has that kind of jacket. This is the coat. And the reason I don't show his hands is because that's a tell. Because the AI can't get that straight, or glasses on people. But it's just making everybody not trust anything. So what does all this mean? It means that we're going to have this wave of need growing and mounting in the future across Virginia, across the country, but across Virginia. And we've got to have a tuned-up way to provide increasing support. And we have to do this at a time when we can say, we're here to help you, and people go, I don't know if I trust you. So, wow. Well, that's the downer part of this point. Now we've got to think about where do we go? So that's what I want to share with you, a new perspective that can build trust, scale our support, and increase our collective impact. All right, Anybody here see the Texas eclipse? Okay, one person over here, another person. Great, three. Well, I took my whole family. I chased eclipses as a hobby. My dad used to do it. Here we are in Texas. We found some blue sky, all excited about it. And wow, was it beautiful. Total eclipse. You got to be in a total eclipse to really understand it, not a partial, night and day, literally. But this is what it looks like. But something remarkable happened after the 4 minutes of totality. We're hugging each other, we're crying, it's my adult children and their spouses, and we're like, oh God, this is so spiritual, it's so amazing. And then we heard a rooster crow. Shortest night ever. 4 minutes. You know, and I listened to that and I said, wow, this is really profound. We're in the middle of a Texas field, looking at the whole horizon over here, this rooster really get off, and I went, you know what? What an insight. A new kind of perception he had of the 4 minute night. You know? And so, wow, that's what we have to do. We've got to think about this and kind of cross our arms a different way. Expand our view of anchor institutions. And really use that expanded view to advance the collective impact model. Something we all know and we all practice. It really works. So expanding the view of anchor institutions. Well, the first time this term was used was David Morass, 60 years ago. He talked about his universities really becoming a compelling pillar of community and really doing a great job of economic development work. And you know, that evolved from there to the 2000s, 2010, and it really looked at anchor institutions as really being a pillar of the economy, of these really big organizations helping out, spanning a little beyond healthcare institutions and education institutions. And then today, it's evolved to where it's organized in part a lot by the people in this room, but you really are working on purpose and social responsibility. So it's been broadened, and more people identify with it, but what I think where it needs to head from that first chapter on the work that's expanding is that we've got to start thinking about who is an anchor institution and how do we broaden that tent. These are your traditional anchor institutions. It's you guys. Many of the people in this room are the people that you work with that really organize causes and address them. And there's some shared definitions about these big institutions. These are the 10 that I keep seeing over and over again, and you guys are going to get copies of this deck, so you don't have to take copious notes. But when we started thinking about this and we looked at these, you know, most of the terms here skew with a bias towards big, a bias towards kind of David Morass, where we're starting. And I think it's time that we disrupt that we become that rooster that crows a little bit because it's a 4 minute night. I think it's time for us to think that we're beyond big institutions. What if everyone felt as empowered as you guys do? What if everyone felt that they were part of the big tent in terms of delivering for the community? And so I think tomorrow anchor institutions are going to be known as community impact agents, where we are all anchor institutions, where we all are embracing this concept, and we're sharing authority and power with everyone, because it's going to take an army. So today, when you think about an anchor institution, it's about size and scale matters, but I'm hoping we get to a point real shortly where it's about local institutions, smaller nonprofits, even social and cultural leaders, that we all think about ourselves as anchor institutions, community anchors. Today, it's about those guys that are providing resources, but tomorrow, I think it's about intellectual resources and connections and advocacy for policies. That's where I think we're headed with anchor institutions of tomorrow. And this idea of trust, well, you know, unfortunately, not because of anything we've done, but just where society is, anchor institutions aren't as trusted today. And I can show you a list of institutions that are trusted, and there's very few that are. Small business is one of those, and military, frankly, is trusted in our country. So tomorrow, I think that anchor institutions as these community impact agents are going to be more trusted because they're part of a larger network. And I want to explain this by way of this really simple model. The evolution of trust. It used to be the trust was vertical, especially with the silent generation and even some of us boomers. It was the individual giving trust to the organization. The organization is going to take care of us. That is totally shifted. Now it's horizontal trust. It's the individual trusting the wisdom of the crowd. It's all the other peers out there that tell you, is this a good Airbnb to book? Or is this a good restaurant to go to? It's not just one person, and it's certainly not that restaurant, right? So just think about this shift and what it means to be a community impact agent. So we've come up with 10 characteristics of a modern day anchor. And we have this sheet for you, and Bess Littlefield will send it out afterwards, but this really goes into one by one an anchor institution defined today and what we think it's going to be defined tomorrow across these 10 attributes. And on the back side, you give yourself a score. Number 1 is not yet, and a 10 is we're kind of nailing it. You know, we really have arrived. And so do this and use this sheet to actually recruit other people in to be this new idea of an anchor institution. And the sheet and this whole scoring system is biased. So people really see that they can be in the Big Ten, that they are. And so I think everybody can get a 70 or 80 on this and go, oh my gosh, let me come in, I want to help. So you take the 10 traits, you look at the points assigned to each one, and you tally it up. No one's going to get 100, but I guarantee you, everybody that you're working with is going to get a 50 plus. And that's what you've got to say. You're part of what we're trying to do. Come on into our Big Tent. This is the good news. You've got a whole bunch of people that are ready to help. And you can't say this about a lot of industries and a lot of causes, but we do a lot of generational studies. And we wrote a book about boomers, we studied millennials, the new alpha generation, and Gen Zs. I tell you, when you think about millennials, and everybody likes to poke fun of them, but they were the vanguards of a new kind of way, a new view of society. These are the 28 to 43-year-olds. And Time magazine called them the me generation. Time was dead wrong. They really missed this. You know, where you are in Wonder Years shapes you as a generation, your generational values. Remember that show, The Wonder Years? So that was Fred Savage kind of experiencing all those things and becoming a young boomer. So when millennials were coming of age, this is what the external world was like. But in our studies, we figured out that it wasn't as much the external factors as it was 2 internal factors. It kind of insulated them, if you will. It was how they were raised and how they were wired. 2 internal factors that were huge in their wonder years. These guys were born to boomer parents determined to do parenting right. We're change agents. We're going to redefine everything's done. That's who we are. Love to work, live to work, and live to really make a difference on things like parenting. So we put cameras on the cribs and watched every one of their moves. And we celebrated that. And in fact, we told every one of them, you're special. I did it. I put up trophies in the room. I showed up trophies, and certificates. I went to school every day. Of course you're supposed to do that. But I didn't know. I was trying to change parenting. So I want you to think about this. We raise people that think they're very confident all-stars. Okay, well that's good. I'm going to give that to millennials and kudos to the parents. But we also did something else. We raised them at a time where we gave everybody a cell phone. And they were smartphones. And so this group was hyper-connected to one another. They are digital natives. They are hyper-wired to each other. So I took my daughter fishing when she got into college. Her brother went to Kansas City, not her. It's still all male. But she got into college, and I took her right out here, actually, where the James hits the rocks, and we were shad fishing. And that morning, she caught her first fish. I caught one. She caught a second one. I caught a second one. She goes, Dad, take a picture of me. I said, I'm fishing. So I did. And then I kept fishing. I caught 100 fish. She didn't catch any more fish. So I'm taking her home. I said, God, you skipped school this morning. It was such a cool experience. Why'd you stop fishing? What do you mean? I said, Rebecca, I caught 100 fish. You caught 2. She goes, Dad, you don't get it. I was fishing with 100 of my friends. And as a research guy, I went, oh my God, what an insight. Wow! I live experiences, but these guys can't have them unless they're sharing them. That's who they are. Experiences must be shared. They film the concerts. They film their food. I mean, it's like, what? But that's what it is. But the thing is, I want to leave you with this idea. They created some kind of new orientation called the collective self. The collective self. It is horizontal trust, right? We trust anonymous posts, reviews, recommendations. The crowd rules. Back to that idea of no one trusts us as institutions. These guys trust the wisdom of many. It's better than the thoughts of a few. So this could be actually a resource for us if we want to build trust. But here's the catch. We told them they were special, but but then they feel like they're part of this collective self. Wow, is that a paradox or what? It's not really. When we told them they were special, we said, you're special, and you're special, and you're special. It wasn't this comparative idea that I'm better than you. What they heard from us, whether we meant it or not, was that we're all special. We're all equal. No one is best. Wow, what a profound, profound thing. So the new mantra is we, us, together. And so when you look at millennials and you ask them the kind of things they want to support, they think purpose is huge. Purpose trumps mission. They want your company, whether you're a private sector, for-profit, or non-profit, to have a purpose, have a mission. You guys support a lot of that. Purpose trumps mission. And purpose is your why, not your what, not your how. So as boomers growing up, I had 2 paper routes. I go to a cocktail party, the first thing I say to somebody I meet is, hey, what do you do for a living? It's the last thing a millennial does. They're out to make a difference where they work. And if you look at the Gen Zs, they're following the footsteps. 83% said purpose matters where they work, and 72% it matters on what they buy. So I want you to think about this as a profound group that's headed our way. Today, millennials and Gen Zs are half our workforce. Just look out into the future, 2031. 75% of our workforce, millennials and Gen Zs, they win. They win. They get to make the new rules. We're wrong. And so just file that away because purpose is going to be huge in the future. Purpose is going to be huge. So what this means is that expanding this concept of anchor institutions is coming at this perfect time. If we can think about it as community impact agents, it's going to create a growing and trusted army. And that's what we want, to make a profound difference on something we all know works. We have been working this model of advanced collective impact for some time now. I love it. It's proven. Now we got to scale it. We just got to leverage it. This thing came out, theoretically written about collective impact 40 years ago. And, looking around the room, we all know it's got these piers, these components, these pillars: common agenda, mutually reinforcing actions, backbone organization, shared measurement system, continuous communications. And we're perfecting it, but we know it works. In fact, if you look across Virginia, there are dozens and dozens of causes that have benefited from this collective impact approach. This is just a few listed, because we know it works. But growing the number of anchor institutions can really leverage this even more, having people feel even more part of our work. There are a bunch of benefits. I've got 20 that I've identified. I'm just going to take you through some examples real quick of how this expanded view really makes a difference. Increasing engagement, community engagement and ownership. Get more stakeholders to really get involved and get buy-in. Serve Virginia is one of our clients, and we've helped them do a survey of 60. We said we didn't know how many people participate, but we got 6,400 people to volunteer to take a survey. And then with that, created the Virginia Community Engagement Index that a lot of communities are using now. But to get this done, we turned to volunteer organizations who really pushed it out locally so we could really have a perspective across Virginia's communities. So volunteer agencies are anchor institutions. They're this community impact agent that I'm talking about. Promoting multi-level government involvement, engaging the government in different ways, if you will. So anybody heard of the Jefferson Davis Corridor, Route 1, that runs from Richmond to Petersburg? A lot of poverty there. How can we help them? Well, one thing is we've got to have more transit so people can get their jobs. And so we said, gosh, would you want to have transit services here? It's hard to get people to take surveys. That's what we do all day long as a company, to get people to give input. It gets back to that trust thing. It gets back to how you innovated to reach people where they are. So in this case, we turned to the Chesterfield Police Department, who took these door hangers and went in trailer parks and hung them on doors and talked to people throughout the community. Oh my gosh, we got over 2,000 responses. We put up 2,000 door hangers, we got 1,000 responses. And we took those responses And we went to the Chesterfield Board of Supervisors and said, well, you got 74% that really need this. And they went, holy cow, let's do it. And now there's bus service running down Jefferson Davis. The police, an anchor institution. Oh, engaging high-profile leaders. I love this one. You know, if you get rock stars behind you, or you get people that are viewed as leaders to come in and work with you on your programs, it can give a little more added value. So one thing that was happening during COVID, Sentara and Truist joined together to put these We Care packages together. Because you see on the right, we realized that after all the federal money raining down helping people the first couple of months of COVID, when we were all asked to stay home, there was going to be a deficit of money. So we said, let's get these packages on pallets all over communities across Virginia so we can drive out and pick them up and have meals for a week. Wow, we put this together, but before we rolled it out, we said, we gotta get some rock stars behind it. So regardless of your political affiliation, we called one of our friends and said, hey, Governor, you think you could get involved in this? He said, absolutely, I love this idea. By the way, do you need some extra money? Oh yeah, sure, we'll take that too. But the fact is, he got together and he went all across Virginia with Truist and Sentara to bring recognition to this whole effort. And it was really so well timed and so appreciated by the food banks across Virginia. So the governor, the person as an anchor institution, is what you want to think about. And then diversifying participation, expanding the sheer numbers of diverse voices, which I think we all try to do. Right now, Sherry Armstrong, I think she's going to be here late this afternoon. She runs the Community Foundation for Greater Richmond. And she is orchestrating a vision for the Richmond region on what we're going to be like 20 years from now, how we're going to move forward with an action framework. And it's all about, we can't leave people behind. We're leaving children behind right now in every community. And if you start looking at neighborhood data, you start to see it, like the average 35-year-old, what they make. And it's so different from one zip code to another. So how do we address this? Well, if it's going to be stale, male, and pale people like me up on the stage saying, we got to go, it's not going to work. Before you roll it out, you've got to get everybody behind it. So for 2 years, we've been working on briefing major associations and organizations and meeting one-on-one with community leaders and neighborhood associations in the neighborhoods that we're trying to really help and really getting the story out and surveying the underserved. And so doing all this work really is putting minority neighborhood groups as an anchor institution, looking at them as somebody that's part of the solution. And then expanding or enhancing resources, another benefit of expanding the anchor institution definition. And this is broader participations of diverse organizations. I am running something called RBA 757 Connects. It's a mega region of Richmond and Hampton Roads CEOs trying to help both economies if we can work on things like get the I-64 expanded to 3 lanes. And one of the initiatives we have is becoming a global internet hub. Y'all ever heard of that term? Global internet hub. Well, there are these all around the world, and great things happen when you become one. If you put the assets of Hampton Roads, digital assets with Richmond's assets, together, we are a global internet hub. And that's what we're telling the world, and we're trying to drive investment in this faster. But we do not want to become a global internet hub that just gets the rich richer. The soft underside of this is how do we have some soul that we become the next global internet hub, but everybody is digitally wired. Everyone in our neighborhood. That's what we want to do. So we had to figure out how to do it, and we found a group, PCs for People, and this is a national group that refurbishes computers, trains people at YMCAs on how to use them, and then puts internet service in a house. And we saw them in Kansas City on a chamber trip. We said, golly, this is awesome what you do. Would you tell us more? And they said, yeah, well, every time we put a computer in someone's hand, their income in the household goes up 15%. Half of poverty people don't have computers. I said, oh my gosh, we got to get them here. So we started talking to them, and they said, yeah, we're in 10 markets, we want to expand, but we can't come to you. I said, why not? Well, you're only 1,000,003 people. I said, no, Hampton Roads too, we're 3 million. They went, oh God, that's our model. We need to have at least 2 or 3 million. Maybe we can come to you. So now we're in very serious talks with them to come here. But I want to tell you the way this is going to work is that the IT directors of all the companies are the ones that are going to have to give the computers away to get refurbished. So when I think about this, corporate IT directors are anchor institutions. Just thinking broader about all this and adapting to local context, another huge benefit. This is having a broader set of institutions allowing for the solutions to be tailored locally. I want you to take a look at this video because I think this captures what's going on in Charlottesville.
The environment I grew up in, it was not very comfortable, not very safe, not very secure. The condition of my home was not the greatest.
I've been out here since I was 3 years old, about 27 years. Moved out here with my mom right when my father passed away. For so many years, and I had no idea why. It was a really bad area out in South End, and we come to find out it's the sewer line underground that busted. And when I found out about it, I'm like, wow, we're still living out here. This is crazy. Big time health concern.
So I wanted to share that with you.
I moved to Southwood when I was 5 years old, and so this is all I know. I have nothing to compare it to. So I would just tell myself, just wait and see, be patient, and it's going to become a beautiful, safe, secure, structurally sound place. Because growing up, that's something that I did not have.
Being out here and seeing what's become of this is truly fantastic. As the times go on, everything shifts, and this definitely needs to happen.
Habitat has worked in partnership with Sentara, for example, and has created an environment where people are welcome, and people feel like they can come and sit down with architects and design it. Myself and my mom were part of those meetings, and just being there, being present with the community members, the other neighbors in Southwood, it was such a unique, one-of-a-kind experience.
The design process has been really interesting because I've never really seen it up close before. You're going to vote on street names, you're going to vote on, the townhomes, the styles. Anytime I walk out here, I know I like to stand for something. So this was fun. I was doing drywall, I was helping with paint, walking through the model home after it was built, and doing my lot selection, and doing the selection for all the details that I want to do in my home. I can breathe easier. Like, hey, this is actually going to be okay.
Moving into a new home is like moving into a new chapter in my life. It's essentially going to feel like I'm in a new area.
This is what it was, and this is what it is now, and just look at how it rose out of that, like a phoenix out of the ashes.
I want to share that because I want you to think about architects and builders as the new anchors. Those guys really made this happen. Sentara was there with funding consistently, but the community impact agents were much broader than we traditionally think of them. And so when we expand this definition, it includes everybody. It's a big tent. And I know you guys have stories that you could put here. And I want you to just think back on all the things you worked on and the things you're working on and say, wow, those guys were bold to step up and work with us, but how can we get more that feel like they're in the tent? That feel like they have our same power, maybe not our same money. And so the immediate next steps to make this happen, you've really taken the first one, you're here, which is great. But I want you to think about embracing this new perspective. I want you to think about this beautiful rooster crowing, reinterpreting and re-envisioning what a night is, only 4 minutes. And I want you to expand your view of anchor institutions and really the real power of collective impact and what that can do. So lean into your leadership role. You guys are all leaders. You run all kinds of foundations, organizations. Share the big picture. The millennials and the Gen Zs, they really just don't want to do things to do things. They want to say, why? What's going on? This is something that we put together for the housing continuum to show where affordable housing fits in. But be able to map out the ecosystem you're working on so everybody gets that shared vision so they can contribute equally. And then recruit and mentor these community impact agents. These guys, people want to be invited in. They want to feel like they belong by having this invitation, this direct hand, come in and help us do this work. Be a big tent as an industry. Use our little dopey survey, when you're recruiting people. I have a couple of copies here, but use it to let people know, look at your score. You are an anchor institution. You are part of this. You are one of these agents. But act fast. We gotta do this, man. Only sleep for 4 minutes like the rooster. We gotta do this. The wave is mounting. More and more people in our churches and places of worship, which used to do a lot of service, the attendance and those, they're declining. So we got to step in the void and make up this big difference. Really do the job here. Really evolve our model faster where everybody's a community impact agent. And if we do this, we make everybody a community impact agent, and we leverage the model we already know. We already know collective impact works. Do this. Do this for the coming wave of need. And do this for, frankly, for generations to come. So thank you guys very much. It's been a real honor to be here.
Please give John a hand again. John has let me know that's why I don't touch my television control. My kids do that for me. Just want to say Mark Johnson, Senior Vice President, Community Development Manager for Truist. I know all of you know Truist here. It's a merger between BB&T and SunTrust Bank back on December 7th, 2019. And so I know John had mentioned some of the work that we're doing in the community, especially with great partners like Sentara. And then when I look out in the audience, there are a number of you that I've known for years and been partnered in the great work that you're doing also in your particular community. And so to continue the conversation in terms of our panel, to expand the view of anchor institutions, connection to social responsibility. As you can see, a good listener kind of steals or lifts from people like John. More than just a conversation, I always talk about many of our roles as thought leaders, having conversations, building relationships, moving beyond just resources, but really looking at, and I kind of put an exclamation point here, put your story here. Stephen Covey talks about the 7 habits, begin with the end in mind, go into the end, visioning, and then come back and modeling that behavior. The individuals that I'm bringing up as a part of this particular panel, they do that on their everyday basis. And so wanted to bring up at this particular point, Melissa Perry. Health at George Mason. Amazing partner, of course, Sherry Norquist. And then last but not least, Valerie Liggins. At the Cameron Foundation. Good morning. Absolutely. And so as we kick this off, we talked about in terms of anchor institutions, internal support. And so, in terms of being a successful leader of anchor institutions, it requires internal support. What are you doing to build this internal support? Sherry, do you want to kick this off?
So, good morning. And as John said, I feel like the first step is really happening today. And I like to look at it not really as a first step, but we're already 10 steps down the road. I am going to change the time narrative a tiny bit. There's no 4 minutes in this work. It's, you might only sleep 4 minutes at night, but we've been doing some very strategic work for 4.5 years. And when I sit and look at these videos and I think about the way that we've utilized our story and that lived experience, something really resonated with me about sharing that. And to gain that internal support, it's really been about how do we share those life experiences? What is the impact? And I will tell you, there's not currently one dashboard or one report that's going to get you the answer. In full transparency, I'm a nurse by training. When I think about social determinant work, that 80%, that big percent of work that we are all doing on a daily basis, it's literally pulling one string on a sweater that leads to 10 other things. And so you can't measure that. It's not linear. And so when we are talking about this work, Mark, we have to think about how do we level set the expectation. And I work in an industry where it's like, here's your measure, here's your intervention, now tell me your outcome, right? It's very fast. And this work doesn't happen in that way. As you saw, we've been doing anchor work for 30 or 40 years. And to be honest, the statistics are getting worse. And so we've got to get really good about leveraging this support, having our partners help us tell the stories of how we are changing lives on every single day.
Outstanding. When we talk about engagement and participation, fostering engagement from the community and key stakeholders is becoming harder and harder. There's apathy, distrust, always some differing perspectives, among strong community members, and new tools are needed. The newspaper is no longer the way. What are the best ways to engage people? What are the best ways to build trust with members of the communities that you're serving? And then lastly, how do we mobilize collective action towards common goals?
Fantastic questions. I'm so delighted to be part of this panel and also coming after that very inspiring keynote. In reality, I have to tell just a very brief story. I grew up in a very rural area of northern Vermont. And as I was growing up, my journey from my small town to the local university in Burlington, Vermont, was actually a point of disruption and shock. I really had not spent any time in Burlington. And as I was growing up, I would talk to my fellow girlfriends and we would say, "Can you ever imagine driving in Burlington?" And we would say, "No, we're never going to do that. We're never driving in Burlington." Well, eventually, I was able to get a full federal support and scholarship to go to university. And that was the beginning of a journey. Now at George Mason, I feel so much a part of that same journey. And what I realize is that our mission is to bring people in. Our president, Gregory Washington, talks about the Virginia Promise, which is essentially, if you are interested in getting a great education and you want to do the hard work, then we want you here. And that has been so transformative in my experience because Mason is my 5th institution. I've been at a number of Ivy Leagues, Harvard, Johns Hopkins, George Washington University. That wasn't necessarily the purpose or the mission by any means. The purpose of the mission was actually to keep people out, to be honest. We prided ourselves at those institutions in saying, look how many thousands of people we've excluded. So, back to your question about being able to create trust, you truly do have to be mission and purpose-driven. You have to be absolutely authentic. You have to be incredibly inclusive and live it in a very, very authentic way. And so talking about, for example, inclusive health care, I don't think I can think of an American or a Virginian that doesn't care about health and well-being. And so when we say our purpose is to make sure that every person is able to live a healthy life and gets access to the best healthcare possible, that creates trust. That creates belief, and that creates hope, and that creates impact.
So Kim, can you talk, and adding on to that, can you talk about your work with school-based health center in Pittsburgh?
And I would go back a little bit too. When I also think about building trust and engagement, it's really going into the community, it's really being available to the community, and to really take a pulse on what the community needs. So for instance, when you think, especially as philanthropic members of the community, you know, our grantees sometimes come to us to sit on their advisory councils, to be a part of their process. A lot of times we're asking them to be part of the organization's process, but we're not a part of their process. And I think when we start to be a part of their process and be a resource to them based on what they need, they begin to trust when we come to them with some of the things that we want to invest in. Going back to the school-based health center, in our community, this was pre-COVID and everything else pre-COVID and post-COVID. Pre-COVID, we worked with Collective Action Model, and it was a combination of funders, United Way of Greater Richmond, Virginia Premier at that time when before they merged, Crater Health District, our local health district, as well as our FQHC, Central Virginia Health Services, and numerous stakeholders in the communities who assessed whether or not it would be a good idea to bring a school-based health center to our community. It was a long process, so part of collective action is also being patient, because it's not quick, it's not fast, it can be frustrating, it can be exhausting, but you have to stay the course. And when you stay the course, again, it builds trust, because people see you over time and they build that relationship over time. And so as a part of that process, we did all the things as far as looking at data. We did a data walk. We had a lot of debate as to whether or not it should be on a preventative level or whether it should be intervention. And again, we had to really be very cognizant that we really have to hear what people are saying. And that's what we took the time to do. We really heard what people were saying, and we really brought in expertise and technical assistance to help us decide where that was going. It was a 2-year process. We subsequently opened another school-based health center in collaboration with John Randolph Foundation. That was only a year process because we learned a lot from that 2-year process. And candidly, there were less people at the table. But I think when you look at a collective action model and building trust, it's understanding the barriers as well as the success.
Outstanding. So we talked about internal support. We talked about engagement and participation. One of the other major foundations is collaboration and coordination. And so effective collaboration among diverse groups with different interests, goals, and work cultures can be challenging. Misalignments and conflicts often arise requiring conflict resolution, strategies with strong leadership to navigate and maintain cooperative efforts. So with this being probably a big issue, if so, how do we manage those particular issues or challenges?
Would you like me to answer that? Actually, I would start out by saying that it's not a zero-sum game. And too often we approach the enterprise as from a perspective of scarcity. So working in public health for the past 35 years, I've never seen it as a competition. That in fact, there will always be a lot of public health problems to go around and to essentially share, if you will, to combat. The other idea is that it's not a pie that can only be cut in slices. That the opportunities, both the problems and the opportunities are enormous, and that the greater collective action, the more synergy, the more energy, the more purpose, the more impact. Starting with that mentality, I think, is very, very important. I've lived in other countries before. I've traveled to over 25 different countries. Much to our credit as Americans, we are known as one of the most competitive countries in the world. And it does drive our economy. It does make for good economics. When it comes to the well-being of humans, when it comes to public health, when it comes to social services, it's not a competition. And so we work hard at being able to convey that there's room for everybody. And that gets back to that message of inclusivity as well. Coming to George Mason, it really flipped my mindset on its head. Having been in those places that it was only about a limited number of spots, limited number of prestigious, rarefied spots. But if you were competitive enough, you would be able to get in and ultimately succeed and leave all others behind. But at a place like George Mason, and I think this is very reflective of the way in which Virginians show up for each other, it's not about exclusivity, it's not about zero sum, it's about there's plenty of problems and plenty of solutions for all of us to share.
And I can add to that. And one of the things we manage with the Foundation's community health needs assessments, and I'm sure everybody's very aware of those. And one of the things that we make in the spirit of collaboration and coordination is working with our local public health agencies. And what we have found is when we work with our local public health agencies and work in concert with them, it helps them to develop their community health improvement plans. which also brings in individuals across sectors to the table. So that's another way that we engage community across our region. Because as a foundation, we serve about the health department, 9 localities, we 7. And so again, it expands our reach even further because we build that trust with those individuals at that table. So that's another way we build collaboration.
I wanted to talk a minute about this collaboration and connection. And I understand that this is the funders network, of which I'm very proud to be a part of. But one of the things that I always say is funding is magic. It's the magic fairy dust that really starts the conversation or opens the door, but it's also not sustainable. And so when we're working with organizations, in order to drive the sustainable plan, you have to build the relationship. And that is what I'm talking about when I say it's not linear, it's really circular. So, okay, we have a funding opportunity here. What does that mean long term? Is this a possibility, for instance, for us to increase referrals to your agency? What other things are you working on from a capacity perspective that we need to better understand, which now means I'm in relationship? I do believe that funding is a trust-building mechanism, but it is not your long-term sustainable plan. And sometimes the value that is added is literally a simple connection. It's very, very easy. It's a listening skill. It's an authentic skill. But how do you get to the meat of what someone is working on? So back to, I'll use the food banks because we like to talk about our friends at the Federation. We had a program that we were going to fund in a neighboring state. And when they started, and I was listening and I started to hear what they were working on, it sounded like they were going in a similar direction that some of our partners were in Virginia. Now keep in mind, I understand Virginia doesn't fund North Carolina and the other, but when I was able to start talking about the program and bring my friends from North Carolina to see, to walk, to listen and to hear what was happening at our Virginia Food Bank friends, they were able to take that model. Can you imagine the value of just that simple connection? There was no funding involved in that particular action, but being able to make that connection was the long-term generational change that is going to be needed to make that work sustainable.
Outstanding. I'll throw this one in here. So you know what they talk about, because I still hear people say we're still kind of coming out. We have a hangover from COVID. What COVID did is it made us a little bit more, or a lot more isolated. Are we still kind of in that mode where we're more isolated, siloed in how we think and how we do versus getting to the point of collaboration and engagement?
I would say yes. I definitely think pre-COVID, again, there was more collaboration and coordination. When we came out of that because of a lot of the funding streams, it separated people as they got the funding streams, which was a good thing. But it also means that everybody was really intent on doing their mission, their purpose, and not really looking around them to see what other organizations were doing. Now that some of those funds have started to stop, then you're starting to see people coming back to the table more, looking more purposefully at what other people are doing and trying to combine their resources more. I think also as a philanthropic organization, it is making us take a pulse at where those gaps are because that funding is going and how we can help support those agencies that are doing really good work but are in danger of having to stop that work.
I was going to say, I like that because the question I was going to ask, do we do a great job in promoting who's doing, I don't know so much who's doing it right, but who's doing it effectively and having an impact, and therefore those characteristics are the kinds of characteristics that we're looking at for an organization that we would like to provide resources to?
So I want to go back to this concept of social isolation. That is a real issue. But when you ask me that question, as a healthcare institution and as a provider, I instantly go, that was a catalyst. It was not pushing us further away. We were going in, right? We were running into the fire while potentially other organizations were running away from that fire. So I truly believe that COVID was a catalyst for us to better understand, be agile, and move quickly through things that have been problems for generations. And so we were quickly in tune to the disparities out there. And who did we need to tap into, which is your question, I think. Who are those organizations? Oh, guess what? They weren't even at the table before. You know, these churches, if you want to talk about lean, mean fighting machines, they're working their model on generations of volunteers. And as I've gone to different organizations, large and small, that's the secret sauce. Long-term volunteers, people who have volunteers who know what they're doing. You know, they're not leaving when things get tough. They're in it to win it. They're not getting paid, but it's like pay for passion. You know, they're doing that work because it's part of their mission and their heart work, the purpose for their living. So COVID was really good for us to flush out and to learn and to listen to those small organizations. And what did you see out of that? We started to see where we were making a way for funding for some small organizations and faith-based institutions. That's not super traditional. And guess what? You're not going to get a robust report. It's just not going to happen. I call it turkeys and backpacks, right? These things are absolutely necessary. You cannot ignore the turkeys and backpacks, right, for that immediate need, because it has to happen in what it builds trust. That's how we get in. And then how do we work with you for the next event, the larger event, the generational change? I'm always focused on what's happening today in our emergency room with homelessness, but also what is happening at that state level and at the generational level of affordable housing.
Outstanding. And so staying in that frame, looking at consistent funding, and then long-term sustainability, we're looking to ensure long-term sustainability of community projects beyond the initial funding, which is always, and that's a capital A through the S, in terms of the issue. Creating self-sustaining models and ultimately operating independently of external support is challenging but always necessary for lasting and sustained impact. So the reliance on grants, donations, and government funding is unstable at best.
Yes, that's absolutely true. The reliance on funding streams has become more and more unstable. Back to the points about the excellent points that have been made already about the tremendous, profound disruption of COVID and the pandemic, once in a century experience. We also learned that we could move, and we could mobilize, and we could be nimble. And there were remarkable partnerships and also entrepreneurship that happened to ultimately get us through. Everywhere from the information that was being shared about the pandemic itself and the infections across the country, but ultimately the vaccines that came forward. And when I came to George Mason, it was just in 2022, what I discovered is that I had a really tall order to follow because the university had just stood up a remarkable testing and vaccination campaign for the entire community. And they did it in record speed, and everybody was involved, everywhere from our school of nursing to the president's office to any student volunteer that wanted to join in. So they were able to really show up for community. So coming in as a new dean, I understood, well, this has to be the new normal. We have to continue to mobilize in that very reactive and that very responsive way. So related to funding streams, I think it's about rethinking. And as was pointed out, that we had some difficulties responding to what these challenges were, but we also showed what we could do in times of a great reckoning. that there were a number of pressures everywhere from how people were working to the kinds of racism and discrimination that were inherent to the mental health pressures that many, many Americans were experiencing prior to the pandemic, and it was just amplified. So it almost was an opportunity to see things very, very differently. In the healthcare space, let's face it, there were so many disruptions during COVID, everywhere from people not it being safe to even go in for routine medical exams to not getting those optional surgical procedures. And we haven't recovered from that. So there was a recent report from the Milbank Quarterly about the status of U.S. healthcare in 2024, and the subtitle of the report is "No One Will See You Now." I'm sure many of us find that very familiar, and it was the schism and the disruption that happened during COVID. It's a great opportunity to do things differently. So back to the point about funding streams, we can do things in a more sustainable way, recognizing that we had systemic problems that can now be addressed.
So I want to give it to both of you, but I also want to add in, do you need to see other funding sources in place before you commit?
I would not say that is the case, because if we're not innovative and giving people a chance to really demonstrate what's possible, then we're probably missing out on something. And I have many examples of where we have taken some risk and really worked alongside of, not just here's your check, there's the transaction, go for it and be successful, but it's more about walking arm in arm, hand in hand, walking alongside to say, okay, I get it, that didn't work. What can we do to help? What's the next thing? So, reassessing and revisiting the situation. So the bottom line up front is no. I wouldn't say you have to have a lot of other funders. Sometimes we go to that place because we need to know that it's going to be a good investment for the community, and that's back to your point of community health needs or a community health improvement project. So I do believe that you have to be available and spend the time walking through what those programs are and what you hope to achieve together with those programs.
And for us, a lot of times, not a lot of times, there are many times we are first dollars in. And so with the school-based health center, to give you an example, with the first one, we were first dollars in terms of technical assistance to assess whether it was a viable model. To add to the last question before this one, that school-based center was scheduled to open in 2020. So we all know what happened in 2020. And so there was a lot that was done to work with the FQAC to keep that model afloat. When we opened the one in Hopewell, it was after COVID. And so even now, what we are doing in terms of first dollars in is evaluating those two models because there are very tangible differences between those models. And we're going through an evaluation now because we have other localities in our region who want to open a school-based health center. And what we want to do is assess what are some of the challenges, because again, there's a potential we'll be first dollars in depending on what happens with this evaluation with those other centers. We're also a lot of times first dollars in because we have a very robust capacity building program. We have Duke University that provides classes to our nonprofits on site. We have a consultant partner that provides supports to those individuals in leadership. And then we also have a skilled portal that we have our grantees take advantage of as well. So on the capacity building side, a lot of times we're first dollars in. And we provide support to them after that in terms of their strategic plans when they approach us for grants. A lot of times we're first dollars in for what we call grassroots organizations or those organizations that are startups, going to the point that you just made. those that have the backpacks, and you're like, oh, I don't know about that. But then you see that they're able to touch communities that other large communities can't touch.
I was going to say, a part of the determining impact process is measuring and reporting impact, data decision making. So one of the big questions is, how do you gather and analyze data? And is the data and analysis shared with all parties? And then how do you do this today? Where is the practice needed?
So I'll start a little bit with, first of all, healthcare data. Some of you in this room are probably saying, that's a funny question, because there's no way we can tap into what the healthcare data sets, not to mention behavioral health. I, worked in many of our emergency rooms and just trying to coordinate care for one patient because they would cross jurisdictions, and because the protection of behavioral health data is so locked down, it makes it very difficult, especially, and I don't want to speak for community-based organizations, but that's what we hear, that this data not being available is a challenge. I know that's another question, so I'll just answer that now. Data is a challenge. We have a lot of data. You can look at the community health needs assessment. Here's the secret. It's like 3 years old. It's Medicare, a lot of times billed data, which comes very long after you've ever done an intervention. So it's not really like you can look at a baseline, do an intervention, and then turn around and try to say, oh, well, we changed the Medicare data. So the good news is, despite decades of interventions, it's still the same, right? So access to care is an issue, behavioral health is an issue. So it doesn't matter what data set you look like, it's not apples to apples, but you will see that those are common themes, right? And they were illuminated during the pandemic. So that's where we start with our analyzing data. When we started this program 4.5 years ago, we took all of our community health needs assessments and we rolled them up and said, where are the themes? And then we presented that, thank you, Valerie, to the community. And we said, help us understand this data. What does it mean to you? Because behavioral health in a red line community where gun violence is a big issue is very different than behavioral health where opioid overdoses is another issue, right? To some people, that's all behavioral health. It kind of depends on how you define it. So we really started this collective impact work going deeper into like the 5 whys. What does behavioral health mean? What do you need to fix it? We do not propose that we solve a community's solutions without that community's input. This is critically important, especially for a large institution or a large anchor institution, whether you're an anchor med or an anchor ed or a financial institution. Being able to take data and marry it with voices is where we start to have the greatest generation of ideas and possibilities for the future of that neighborhood or that zip code for those families.
And I want to add, we talked about it being the long haul. And so just to give one example to lift up. In 2009, we did a behavioral health needs assessment. And we did all the things in terms of pulling people together, doing the recommendations, focusing on what what's the most important thing that needs to happen in the behavioral health world. So this was 2009. Let us fast forward to 2023, okay? Is when we were able, because timing is everything. I always say timing is everything. But finally, one of our partners, one of our FQHC partners, came to us and said, we want to open a recovery center. And when they said they wanted to open a recovery center, it was kind of mixed responses in terms of, not that it wasn't needed, but, we don't have enough data. Well, I went back to that 2009, and literally that 2009 data didn't look different from that 2023 data in comparison. And I think that's all I had to say in terms of whether or not we should take a chance to fund this, because it looked the same. and you said it at the very beginning, Sherry, in terms of, what happened. COVID brought attention to a lot of things, but it existed way before. And so being able to demonstrate that and show that was just a powerful statement to our leadership. In terms of how we measure that, I think we all know that it's challenging. I don't have an answer. I just don't have an answer for that. It's challenging to really measure over a period of time. That's something that we're constantly thinking about. That's something we're constantly working on. But we do know the needs. We know the needs in spades. But how do we measure and look at the impact? We try to work collaboratively with our grantees around that.
Can I put just a brief point on that? Extremely well said from a practitioner and a funder's perspective. I guess I'm thinking philosophically that I've been awash in data for over 30 years. I'm a scientist, I'm an epidemiologist. It has always been my bread and butter to generate data. I think that at this point in time in my career, what I recognize is that, and especially the way in which things have changed from John about many of us might be digital immigrants, whereas Gen Xers and millennials would be natives, digital natives. Even as we are steeped in data, it cannot become the end-all be-all. And in so many ways, our societal relationships have become that. And that's likely part of the explanation about trust. So I think quite simply what I would say is allow data to be a very important tool. John did a beautiful job of sprinkling in some important punctuated data for much larger themes and much larger takeaways in today's presentation. Allow it to be a tool, but not an end-all be-all or a handicapping element to be able to make decisions that may change.
I will say, if you need a tool, right, if you're thinking about where does that tool start and who do I reach out to, that's the beauty of creating this big tent. John, that was really such a good word picture, because where we connect with universities on their ability to research and provide data is absolutely critical. Where we connect with the Department of Health on data, statistics, very quickly, rapid turnaround time. And I don't want to say this because we have a benefit and we do leverage our health plan data, but that for us at the zip code and at the neighborhood level, depending on what market you're in, depending on who those larger Medicaid providers are, they have to turn data around in like 24 hours. So if they get audited, and I'll never forget, I worked in the hospital for a long time, so I always saw Medicare data. But when I started this work, we started looking at where do we put a clinic, and where are the emergency rooms being utilized, and where are the readmissions coming in, and what are those social drivers? The excitement behind the folks pulling the data for these health plan members was literally 24 hours. They were able to push stuff to me, it was de-identified. So I think there's something that could happen there for people working in the community to start thinking about those non-traditional partners for data to make those kinds of first steps in this work.
I was gonna say, I love that. I had a mentor years ago said, create environments of learning. Now John is kind of, he's rolling off of me. I just came up with this concept called hotspots. So we think of hotspots as places you got hotspots and you can launch or generate, for your computer, your PC. Create hotspots for environments of learning where an organization or several organizations can be hotspots for greater learning around a particular issue. I'm going to charge you for that. So, lastly, oh yeah, zero. We have 0 time. So I was getting ready to end with adaptability, sustainability, or scalability, excuse me. So we have 0 time. So everybody, give a hand. Wonderful to be done. So we appreciate this opportunity. Thank you.